Hey, Adam,
Geez,
one
why,
thing.
why do you think they call bumpers scary?
I don't know.
Because they come at the beginning, at the end, like bumpers.
Alex, you're a marketing guy. Do you like that design behind Paul? Does that sweet logo thing look pretty cool to you?
Hey, I forgot to hit the record button.
Yeah, that's really professional, isn't it?
Well, this is a professional podcast.
I met her in a parking lot and was handed two little Yorkies. And the only person I knew that knew Yorkies was Paul. So I called Paul and said, Paul.
Sweet Talk is a weekly 20-minute podcast brought to you by the Continuing Education and Workforce Training Division of Idaho State University's College of Technology. Find us on Apple Podcast, Spotify, and SoundCloud and subscribe today. Now it's time to get started with Sweet Talk.
Hello, everyone. Welcome back to Sweet Talk, our weekly podcast here at Idaho State University's Continuing Education and Workforce Training. I am Paul Dickey, the apprenticeship coordinator here at Sweet. And as always, joining me is Angie Wilhelm, our marketing director. Hey, Angie, how are you doing today?
I'm doing really well. It's a gloomy Thursday afternoon for those of you who are turning in late. As many of you know, those who listen to us quite frequently, this time of year, we do have a series of guests on from local charities and organizations. So today we actually have a new organization on our podcast today. It's Community Bridges. And joining us is Myles Nelson, the program manager for Community Bridges, as well as Mo Esperilla, and he is the director of clinical services. Welcome, both of you. Can you take a moment to introduce yourselves and tell us a little bit more about Community Bridges and what you guys do?
Absolutely. My name's Myles. I'm the program manager here. So thank you guys for having me on. I'm excited to be here. Community Bridges here in Idaho, we just have our mobile crisis team launched. We started out in July, sorry. and but Community Bridges has been around for, I think we're at 42 years now in Arizona. So anywhere from inpatient mental health, outpatient mental health, addiction services. There's all kinds of services that CBI owns and regulates out in Arizona. And then a couple years ago, we expanded our mobile crisis teams into Oklahoma. And then this July, expanded out here, mobile crisis teams. So it's still kind of working out the kinks here, but it's going great so far. And we're really happy to be here and share kind of what we're doing in the community.
I think that what you guys have with this mobile unit is such a needed and interesting idea. Can you tell us a little bit about what that mobile unit's purpose is?
Yeah, so, one of the things that the way we get dispatches through 988. So one of the things that we do want to get, everybody, on board is utilizing 988. I think we've been wired from an earlier age to call 911 for any kind of emergency or crisis. So, I think this is nationwide, 988's nationwide. That's how we get dispatch. And we cover regions 3, 4, 5, and 6. So southeast, southwest of Idaho, our team is covering. And one of the things that we're trying to also, the message is that we don't define what crisis is for anybody. Like there's not a set of like rules or criteria. The member will decide what that crisis looks like. It doesn't have to be suicide, it doesn't have to be something extreme. It can be, an ability to locate services, a therapist, not being able to get into your medication manager. So, our calls vary in crisis. So that's a little bit about what we do. We respond in teams of two. And sometimes we collaborate with law enforcement when needed. We try our best to not involve law enforcement. That's a big reason why this is being rolled out, to allow law enforcement to respond to calls that are appropriate to them, and then we can take a lot more of the mental health other crisis calls. A lot of people will call and say, "Hey, my cat's stuck up there," and they're calling 911. Those, that's just, those some of the calls that can easily go to 988. I think it's important to continue to pass on that message of 988, I would say.
Okay, I'm going to admit to you guys right now, I was not even aware of 988 until you just said it, Mo.
Mhm.
Great. I'm glad that you brought us on, because you're not the first person. We talk to law enforcement, we go to meetings, we go to schools, and sometimes we talk to counselors at schools, and they're like, "What is 988?" And it's surprising, but not. I think it's going to take about 5 to 7 years before this gets start using how it should. The calls are picking up in that region, with Idaho Falls being so close and being so big as well. But yeah, I think that's part of why we want to do this, to inform people to start utilizing 988. Absolutely.
Well, that's amazing because you hear in the past, they've talked a lot about the 911. You typically police are dispatched, and they always say, "Hey, the police are just not trained to help in these mental health crises," and it usually typically escalates because of that.
Correct. And it's pretty traumatic, if you are having a crisis and law enforcement shows up. Um, Oftentimes, if they need to go to the hospital, they have to be handcuffed, right? And it's not needed. So I think part of us being out there and collaborating with law enforcement, it's to prevent more traumatic, piling up on top of already your crisis. So we have our vehicle that it's safe. It's a brand new Explorer. We do have a divider for our safety as well, but it's the back of it. It's not like those hard shells like law enforcement. It's your regular seats. So I think part of it's the experience of being in that trauma response, being a lot more calmer or safer than being in the back of a vehicle being transported to an inpatient facility. Like, that just doesn't feel like helped. So we're just trying to also make that experience better.
Okay, so I've got tons of questions now.
Yeah.
So what my first question is, what kind of training do the people have that responds to the 988 calls?
Yeah. Myles, I'll answer this one.
So for our team, our team members are not working for 988, separate entity, but we have a system where 988 will, let's say they get a call, they'll do their own triage process, and if they feel that MRT, which are our mobile response teams, are appropriate, then they'll send our team out. One of the first things that our team members do when they get hired or we bring them on is there's a state training through Idaho Department of Health and Welfare that everyone has to go through, and that state training just includes how to respond, really all the basics of responding to crisis, right? Like how do we respond to members in psychosis? How do we appropriately assess for suicide risk? All those very basic things that you need in crisis work. So they'll do that training. That's a 3-day training, and then they'll go through our own pretty extensive training through our company in CBI, where they'll do a whole week of CPR, CPI training, so crisis prevention, and then CPR certification, and then they'll go through a lot of just learning the basics of all of our systems we use. Right, we have a lot of documentation that has to be done for mobile crisis responders, and so they spend a whole week just really kind of getting thrown a ton of information, and then they do quite a few weeks of shadowing. So shadowing a team member who's already experienced. A lot of times we'll have them shadow myself or Mo. So right now we have new hires that are shadowing Mo currently this week, so that they get a really good idea of how a clinician goes out there and responds, and how we handle some of those crises in the community, and how we communicate with our community partners such as law enforcement and other agencies. So yeah, all in all, I think that there are some very specific training that they go through, but a lot of it is the hands-on work, right? I mean,
Okay.
you can't prepare for some of the crisis calls that we get. We get everything from, hey, I lost my Medicaid and I need resources to help, or active suicidal ideation. So there's a very vast variety of things, and how we kind of train is, I don't think anyone's ever fully trained. I think our
Yeah.
staff are continuing to
Yeah.
learn. But yeah, Idaho State And the state of Idaho has their own kind of response training that is necessary for us to be mobile responders, and then CBI has our own training policies as well.
So my next question is funding. I mean, is this privately funded? Is this funded through federal government resources? How do you guys operate?
Yeah, right now, right now it's all free of charge to anybody that we respond to. We're going through Magellan. Magellan's the one that has that contract with the state of Idaho. But as of right now, everything's free. We do not ask for insurance. We don't take the information. Sometimes we do take the information if we need to go inpatient to make sure that we're taking them to the appropriate care and it's not a financial burden on them. That's one of the reasons why we would ask about insurance. But other than that, like we don't bill, we don't ask them to submit anything. So at this point, it's all free. So it's an amazing resource out there. So start using it.
Okay. So
now, go ahead, Paul.
Angie.
Okay, so I do have a question as well. As Myles had stated, you have only been in the Idaho area for roughly 6 months, 7 months. What has that been like? Have you seen more awareness coming out, or is it something where you're really seeing that we could have used this this type of service years ago? Like, how has it been working in an environment where this, as far as I know, didn't exist prior to you guys coming in?
And I think that's one of the reasons why the state decided to go this way, to be able to reach more rural areas that in the past. We are stationed, one of the teams is in Pocatello, because they can get to a call within 2 hours. And 2 hours is still quite lengthy, but at least before, it was a lot more than 2 hours. So at least there's about 2 hours. In the Boise area, our respond time is less than 30 minutes. And I think collaborating with law enforcement has been crucial, because the idea is to decrease the calls from going to 911 versus 988. In the state of Idaho, it's illegal to transfer right now any calls from 911 to 988 or elsewhere. So that's why we're trying to push people to learn more about 988. They cannot transfer. Their dispatch cannot transfer the call to 988. The officer can once they're on the field and they've seen the call and perhaps it's more of a mental health, that acuity wise is very low, then they can call 988. But that's a big factor why I think also it's not being utilized, because in 911 they cannot transfer that call to 988.
Wow. So is there any legislation in the work to alleviate that obstacle?
I think it starts with starting from small to big, and I think that's the idea, to get to that point to where we can have more data. What we're looking for right now is the data, and without data we cannot make any points across anybody. So even in the after hours, it's important to still utilize 988. 988 can then transfer the call to 911, right? They can do that. But it's important that the data suggests that yes, like this is something that it's working, that it's needed, and that we need to work towards legislation in doing that. In the state of Arizona, they're able to transfer those calls to 988, and their dispatch is over 500 a month, like calls. So it's
wow.
So I think part of CBI in the company is that they've been doing it for so long that I think they want to model something like Arizona. Everybody wants what Arizona has in terms of mobile response teams. So I think we're slowly getting there, but without data, that's where we're starting off from small to big. So.
Now I imagine an organization like yours has to have good relationships with medical outlets like hospitals and clinics and so forth in order to get the person that you may be helping the care that they need. Is that correct?
Absolutely, and that's a big part of Myles and my job is to develop those relationships with law enforcement, with hospitals, with the region, attend their meetings, and then consistently be in touch with them as to how we can continue to grow this relationship. Being in touch with crisis centers is a big one, utilizing the crisis centers, and being able to go to events and continue to make more awareness of this alternative, I would say, to using 911.
And that's also uh, how is your relationship with law enforcement? I mean, they're so used to people calling 911. Now there's this other source that can be called, or they may transfer. How is that relationship starting to build?
Specifically for Pocatello, nothing but great things to say about them. Like, it's been an amazing um, so far with them. It's constant communication. Right now, like, we're looking at data, and I think cities know that. So Pocatello understands that. So Twin Falls knows that. Idaho Falls knows that. So it's almost like, whoever uses us more consistently, that's where perhaps we might put another team there for more assistance. Um, we don't know where the next team is going to go until we get the data. Pocatello has been very proactive, I would say, in terms
Really?
of use law enforcement specifically. They have been very proactive in working with us and staffing members and calling 988 and being dispatched out there.
Excellent, excellent. Now, as far as staff, is staff paid, or do you look for volunteers, or is it a combination of?
All of our employees are compensated. Yes, we don't currently have any
Okay,
volunteer positions here in the state.
okay. Is that something that you just because of liability insurance, you just don't do, or do you ever consider volunteers?
I'm not sure if they're, I mean, I don't know the exact reason, whether it's liability or not. I think that right now, especially just launching quite a few months ago, right? We're at, I think, month 5.
Right.
We're still kind of working out, like, what does it look like, getting fully staffed, I think, and getting a team, some solid teams together that kind of mesh well and go out and in the community. And so I don't think it's something that we would never consider moving forward. I think right now we're just kind of working out, what it
Okay.
means to launch this program here and get our staff trained and on board. And we're still kind of in that like early stage training
Okay.
um,
A-
area with our staff.
Yeah.
Yeah.
And you are in the early stages. I mean, they're basically this is like the beginning portion of it. What do you hope for the program to grow into?
So
I
we're
would,
we're we're gonna be go for it, Miles. Go for it.
yeah. I mean, I would say having a lot more teams. Right now, we only have 2 teams in the state of Idaho. So we're only launching teams. We're only running mobile response teams from Monday through Friday, 8 a.m. to 6 p.m. right now. As a lot of people know, in the mental health field, crisis doesn't usually live in that 8 a.m. to 6 p.m. window. But starting January 1st, we're launching to 7 days a week, 16-hour days.
Oh,
So we're
Wonderful.
nice.
gradually getting bigger. And then July of 2025 will be 7 days a week, 24/7. So for now, the hope is that we have those really smooth transitions as we start to expand our hours. Um, but like our MRT teams in the state of Arizona and Oklahoma are running. They have hundreds of employees running MRT
Wow. Wow.
24 hours a day. So I think that the hope is that we're able to reach a lot more rural communities, and we can start putting teams in all of the areas of Idaho that are lacking that quick response. At least that's my hope for what we're doing here right now.
Okay. Now, do you find that when your team shows up in response, do you find better outcomes than if 911 was called, or at least better outcomes for the person in crisis?
I think for mental health crisis, right? Mo had touched on it a little bit earlier, but some of that re-traumatization that can happen when uniformed officers show up. A lot of the times, our responders just have a lot of skill and a lot of the tools necessary to kind of help someone who's experiencing psychosis or suicidal ideations, homicidal ideations, and we show up in plain clothes and approach
Mhm,
the situation from a non-punitive aspect,
mhm.
right? And our role is we're not there to get someone in trouble. We're there to see how we can help them and provide resources. And so I think that we've had good outcomes in the sense that, you know, the data shows that 70% of our calls can be de-escalated when we show up on scene, can be de-escalated without needing to go inpatient or needing to go to a hospital or needing to kind of have a higher level of care. And I think that, you know, we bridge that gap between maybe people want to get help and they want resources, but they don't want officers to show up and they don't want to be involved in the criminal justice system. And now that we are available, they have that option, you know, rather than, hey, I can talk to someone on the phone in 988. Now I can actually have a team show up and talk to me face to face and provide that safety and kind of support.
Okay,
Well,
now you bring up
go ahead. Okay, so
okay.
Paul,
Well, now you bring up a good. So not only you, not always dispatch people, but sometimes you can do some care just by answering the call at 988. Is that correct?
Absolutely. A lot of what the 988 does is triage the calls, right? And some of those calls can be de-escalated over the phone. Some people just want to be heard. Some people just want to tell somebody, like, this is what I'm going through. Like, I just lost my dog, my pet, my family member. And I would say 988 is doing a great job at de-escalating those calls. The ones that they can't, it's the ones that they will send MRT to. But yeah, I think it's kind of a partnership with them and trying to see what's working, what's not working. We staff the calls once a week with them, so we're constantly trying to improve the system that we're trying to create here in Idaho.
Well, with that, we are actually out of time, but I think this is. I got one more.
I got one more. So we're obviously going into the holiday seasons. I would imagine, are you guys expecting an increase in calls as we head towards the holiday season?
Absolutely.
I would say that's the unknown, right? Because we don't also have the data on that. I mean, I think you can guess, but our guess is as good as yours in terms of what will happen. But I think that's one way to approach it. We tell, you know, when we meet with providers in the community, is allow our team to go out there in the holidays for employees to have a peace of mind, because we can go out there and do a welfare check on them without informed consent. So it's important that, you know, like, they also have some self-care and allow our team to go out there and facilitate that call.
Well, I would just like to thank you guys. This has been one of the most informative podcasts I've been on, because, like Paul, I had no idea that you had to call a different number for mental health crises. And I think it's what you guys are doing is such a wonderful addition to the resources that we already have in our state. So thank you, Myles and Mo, for being on. And I'm going to go back to Paul because I cut him off.
No. One last thing is, you know, I just found out about this today. I just found out about 988 today. Now, if someone wanted to get more information, do you guys have a website that they could visit?
You know, I don't know. I mean, they can go to our website. It's very broad, I would say. It's a huge company. But I can connect with you, and maybe we can put it on the comments on the video or something. We can put our email address to reach us to us.
That would be great, because again, sometimes they're not in crisis, they just want some more information about the organization.
Absolutely.
And again, it's been wonderful to have you guys on. I learned so much today. I'm gonna go out in my main office and say, did you know you could call it 988?
Yes,
and I think
that's great.
And I think putting that number in the caption for the videos, whether it's on Spotify or YouTube, will really help as well. That way, if someone doesn't listen to the entire podcast, they can still get that snippet that they can call 988 if they are in a mental health crisis.
Awesome. I appreciate you.
Yeah, thank you.
We appreciate you
guys.
Yeah, well, thank you so much. And if anyone out there is interested in what we have to offer here at Sweet, they can visit our website at cetrain.isu.edu. They can email us at cetrain@isu.edu or give us a call at 208-282-3372. And this is our community podcast. This is where we find out stuff like, the services Myles and Mo provide, and that there's a 988 number. So please, if you get any appreciation for this podcast, please like, share, and subscribe. And also, if anyone has something like this that they'd like to share with us, we really would like you to come on as a guest. And as always, be safe out there.